Hello and welcome to Cancer Now with your freelance journalist benign. In our last episode, we found out that although corona currently beholds extensive threats for the elderly, cancer will stay a high-risk factor for everyone as vaccinations against cancer might remain a dream. In today's episode, the basics of cancer, we will find out how cancer develops and who's at risk to be affected. Today is the 15th of May and this is YouTube's only cancer podcast, Cancer Now. Professor Dr. Herzog, you have been an oncologist for over 35 years. In a few simple words, how does cancer develop and what in specific are tumors?
Yes, hello, Mr. Steininger. That's a very important question. How does cancer develop? Here we have to see that our body consists of many single cells, and theoretically every cell may become a cancer cell. We have to see our cells when they develop, they are not staying the same all the time. They regenerate, they duplicate, and so if you look in the mirror every day, we see that our cells change because we become older, which means little errors will happen over this regeneration processes, causing little damages, and so we get wrinkles and we get little patches and pigments on the skin, and so getting older, very visible, and the same happens to all cells in our body. So now let's talk about tumor cells. Tumor cells are normal cells of the body, and when they regenerate, certain different errors happen. Errors which at the end result in a changed behavior of the tumor cells. Let's see. For example, we cut ourselves with a knife and there's a little hole in the skin. From both sides the skin will heal. So at some point the hole is closed and this regeneration process is stopped. So the reduplication of the cells and replication will stop by itself. In cancer it would be different. Cells would continue to grow and will create a node and a lump, and at some point this lump will infiltrate into other tissues around, or even little parts of the lump, single cells may spread via the lymphatic system or via the bloodstream into other parts of the body.
So how do tumor cells develop in general in the body?
You have to see the cell they're attacked by so-called carcinogens, which are, for example, toxic substances when you smoke, but also environmental factors may play a role. Certain viruses may play a role, for example, the human papilloma virus, and they attack the cancer and may cause a first mutation. Also, genetic reasons may be there. For example, the breast cancer gene or other genes may cause a first error in the replication of tumor cells, which finally result in a mutation of the normal cell into a slightly different cell, which has suddenly lost the respect from the cells around.
So what is then the difference between good tumors and bad tumors?
You mean benign tumors and malignant tumors?
Exactly.
Benign tumors are nodules, like little birthmarks, for example, in the skin, which just grow, get bigger, and at a certain size will may cause some discomfort. But they will never lose the respect from other cells. They would never create metastasis, and they just can be removed, and that's all.
So if you compare that to an everyday situation, you would basically say that these tumor cells are the good neighbors that will stop listening to loud music when your neighbor knocks on your door and says, please turn it down.
Exactly. It's a good example. So cancer cells are like that. They put the music loud, and when the neighbor complains, they put it even louder. They put some more loudspeakers in other rooms and then in the complete quarter, and at some point they will, by the noise, kill the neighbors, and not only all the neighbors, they will kill the complete quarter where they live, so that at the end everybody is dead. So the difference is that with the mutation process, that is a first step. Then the tumor cells, these mutated cells, will divide again and create new cells, and further mutations will happen. So a further degeneration of the cancer cells will happen. So this is basically the start of a cancer growth. This kind of cancer growth, by the way, in the beginning, the first mutation, happens quite frequently in our body, because our body is affected by many environmental toxins. But our immune system, in most cases, is able to eliminate the first cancer cell or the first small number of cancer cells. But the more often this happens, the higher is the risk that at some point the immune system will not be in time or not be ready enough to kill these first developing cancer cells.
In one of your lectures, I recently have read about how mutations can be inheritable. Personally, I have in my family a few cases of cancer in the past generations. What would I have to worry about, and what do I have to look for?
I think here we have to distinguish. There are the burdens by a genetic disposition against cancer. For example, let's take the very prominent actor Angelina Jolie. She had the breast cancer gene. She published that, and at the age, I think, of 45, she had both breasts removed as prevention and later on also the ovaries removed, because this genetic situation means that at every year the risk of getting cancer increases 1%, which means at the age of 50, with this genetic situation, 50% of the patients will get cancer, will have got cancer, and at the age of 80, 80%. So after she had her children, she decided to prevent the further development of cancer and get the possibly future cancerous tissue removed. For you, as a person who had maybe in the family different types of cancer, you may not have such a genetic situation, and that's actually the case in most of people having cancer in the family. There's just a slightly higher risk of getting cancer, because if you watch the families, there are families in which several members of the family are stricken by cancer and may die of cancer. But in other families, the majority of people will die maybe from stroke attack or cardiac disease. So here we have to see, for you, in your situation, it's just important to follow a healthy lifestyle. But there's no measure necessary, like, for example, taking preventive surgery or something.
This is basically universal for everybody.
Yeah,
similar cases.
Yes, I would say that's universal. And so most people have no genetic problem, but there are few genetic factors, for example, in breast cancer and also in colon cancer and some rare cancers of certain glands.
Since we were just speaking about different factors, we know about smoking and how it can develop the risks of getting lung cancer and alongside other diseases. However, what other factors can increase the risk of developing a cancer?
The risk is mainly the lifestyle. So there's a big study of the Harvard University already published in 1977 or that early, and this has not changed at all up to now. So the most important factors is indeed the lifestyle, and here including smoking, which is maybe the most important factor. And we have to see that here in Germany, for example, every day more than 300 people die just every day because of diseases caused by smoking. Anyway, the risk to get cancer increases statistically how often your normal cells are attacked by so-called carcinogenic substances, for example, the toxic substances in the smoke, but also other factors, environmental factors. So the more often a healthy cell is attacked by these carcinogenic substances, the higher is the risk that a mutation happens, and the more often a mutation will happen. And the immune system may eliminate maybe 99% of them, but maybe the more often it happens, the higher the risk that at some point the immune system may fail and don't catch the malignant cells early enough, and then you have a cancer.
So could living nearby atomic plants be considered an environmental factor?
Of course, this depends very much how well the atomic plant is sheltered. So normally it should be constructed in a way that nothing happens and there's no radiation outside. But if you look at Chernobyl, for example, or Fukushima, if any accident happens, suddenly there's a pollution all over and many people get suddenly heavy storm of cancerogenic material causing cancer. And here again we have to see the attack of the normal cell by such toxic substances. This is not the only thing we have to see. We have also to look at the so-called latency, which means that your cell is attacked, for example, by toxic substances from cigarette smoke or from an atomic plant, and then you have to wait, and this can take sometimes 10 or even 20 years until the malignant cell clone, the first cell clone, will develop. And here again, in this time, it depends a lot on your lifestyle. So if you have a healthy lifestyle, this may take much longer, the latency period, until cancer may happen. Whereas if you have an unhealthy lifestyle, maybe too much work, not enough sleeping, unhealthy habits, then the cancer may develop earlier.
According to a German statistic, there are different forms of cancer occurring more frequently in either men or women. Primarily, if you look at prostate cancer for men and breast cancer for women, how does that correspond? Why is that the case?
First, we have to see that prostate cancer and breast cancer, they are hormone-driven. This means that here the testosterone in the men and the estrogens in the women, they may activate the glandular cells in the prostate or in the breast to grow, and at some point there may be an overstimulation which may contribute to the development of cancer. There are also other factors, genetic factors, but here this seems to be a reason. So also treatment with hormone products like anabolic steroids or with estrogens after menopause may increase the risk of getting cancer. One in men, the other one in the women. But other cancers in men and women also are a bit different. So the second most frequent cancer in men is lung cancer, and then comes bowel cancer. In women, the second frequent one is bowel cancer, and then comes the lung cancer. Here also interesting to see the history. So 30 years ago, lung cancer in women didn't play a role at all. But as in the last 30 years, more women have started to smoke, and now they have caught up. So now suddenly we have lung cancer already at number 3 in women.
When you look at diagnosing cancer, how is it today even possible to diagnose it when most hospitals around the world are facing the corona crisis?
Here we have to see 2 factors. Let's take for example Germany. In Germany, in spite of the COVID crisis, the hospitals are still functioning. So cancer, let's say if you have a nodule somewhere, a malignant nodule, it will be operated immediately. So I don't see a problem here. In other health systems where the emergency rooms are exploding, where intensive care units are not available anymore because so many COVID patients, in this situation, cancer patients cannot be treated because they are not as acute as, for example, somebody with respiratory disease not getting enough oxygen. So here we have to distinguish between the countries. But I also see a very important other factor, for example, the screening. Nowadays, nearly everybody has fear to go to hospital, maybe to get infected. One point, and the other one is screening and early detection of cancer is often postponed because not so relevant. It's more an elective process, and so this may be postponed 3 months or even longer. And just imagine if in this time a cancer appears and you miss the diagnosis 3 months, this may be dangerous for patients.
So, on average, how long would it take for a cancer patient to die if he or she isn't undergoing any treatment?
Here, this is a very difficult question to answer because it depends on the type of cancer. For example, let's take prostate cancer, a cancer of the elderly man, which may grow 3 months or 6 months or even longer, and this really doesn't matter so much when you start the treatment, because very often this is a pre-existing condition for a long time. But let's take pancreatic cancer. Here the average survival time without treatment is 6.2 months, and so here you have to detect it as early as possible to start some treatment as early as possible to prevent complications and to prolong life. If you wait too long, the patient may have run already into a disastrous situation.
So now I would like to come to the open questions from the users, and the first one is, what is the exact role of the immune system in cancer?
I pointed out in the beginning the immune system plays a very important role in the fight of cancer. So first, it may detect cancer in an early stage. We know that in some cancers, a cervical cancer for example, there is a vaccination possible, which means that the immune system may prevent development of a cancer in the cervix of the uterus. We also know that the new immunotherapies, which address certain targets on the cancer surfaces, these immunotherapies create a reaction of the immune system against cancer cells. So the immune system may play a very important role, not only protecting but also fighting cancer. On the other hand, we have a situation that the immune system may even cause cancer. Let's take, for example, the colitis ulcerosa, which is an inflammatory disease of the colon. Here there's inflammation, there are symptoms like constant inflammation, sometimes even surgeries necessary because there are obstructions. And if such inflammation is nagging on the colon wall for a long time, cancer cells may develop. And then you suddenly have a cancer triggered by the immune system or by an overreaction of the immune system.
So earlier on we touched on how a tumor cell develops, but one of the questions I have here is, what does a tumor exactly consist of?
A tumor cell consists of very often a variety of different cells or different cell types. You can see that under the microscope. Let's take, for example, the pancreatic cancer. So in the early stage of the cancer, the tumor cells may look like cells of the pancreas, some glandular cells, and they look very similar. But the more mutations happen, the more different the cells will look. And the more this changes, the more you also have malignancy. We know in the development of cancer, and we talked about that before, that there's not only one mutation. In the beginning, there's the first mutation caused by the carcinogenic substance or by the genetic situation, but then further mutations take place. And these further mutations, they lead to more and more degeneration of the tumor cells. So at the end, you may have a very weird mixture of tumor cells, which you can see under the microscope. You also see not in the tumor, not only the tumor cells, you also may see inflammatory cells, because the immune system in a very desperate way shows that there is infiltration of lymphocytes and other cells of the immune system. So looking into the cancer cell, it's a mixture of different cells.
Since we were just talking about cancer cells, I would now like to come to our final question of today. Why do cancer cells develop so quickly?
Quickly, it depends. Yes. We talked about the development of cancer caused by mutations. We talked about the environment factors, lifestyle. So it's not really quickly, it's a time of latency. A cancer cell develops and may rest in the body for a while. This can take 10 to 20 years, as I mentioned earlier, and then suddenly the cancer cells continue to develop. And then we have to see there's another process, a kind of selection or evolution process. So the cancer cells develop and they are fighting against the immune system. And the cells able to avoid the attacks of the immune system, these will be the survivors. And then you suddenly have a stronger and more malignant cells. Then you try to attack the cancer, let's say by chemotherapy. Because the cancer cells are different, not all the same, you have some cells which may respond to the chemotherapy, but some others which may respond just a little. And these cells learn and develop mechanisms to avoid further chemotherapies. If you look in the situation of cancer cells, there are different cancers. So for example, there are cancers just with one mutation. These are mainly the blood cancers, for example, leukemia or certain lymphomas. There's one type of cancer cells which is seen as a so-called monoclonal cancer type. So all cells are like twins, have about the same genetic system. So if you have a measure to kill one of them, you can kill all of them. And that's why the treatment in lymphoma or leukemia is that successful compared, for example, to solid cancers like pancreatic cancer or lung cancer. In the solid tumors, you have a development into polyclonal cells. These are completely different cells. They have just their own pattern, which is similar, that they derive from the same organ. But in the pressure by selection and changing the genetic situation caused by, for example, attempts to treat them, they become more and more malignant. And so at some point in this Darwin process of evolution, they will become resistant against any kind of therapy.
So it's like the toughest will survive in the end.
Exactly, the toughest will survive, and exactly this happens when they develop themselves. There's also a selection pressure, so the more you attack them, the more they try to escape and find new ways. This doesn't really make sense, because if the cancer wins at the end, the body dies and also the cancer will die, but the evolution process is the same.
Hereby I would like to thank you a lot for your time today.
You're welcome, Mr. Steininger.
Overall, the development of cancer tumors depends on multiple factors. These include genetic inheritance, lifestyle choices such as smoking and bad nutrition, as well as triggers that lead to the build-up of cancer. And although cancer prevention is largely impossible at the moment due to the corona crisis, it is more important than ever to lead a healthy lifestyle to reduce the risks of cancer. In our next episode, we will talk about the metastasis and the various stages of cancer. If you enjoyed this podcast, leave a like and subscribe to our channel to never miss an episode. This was Cancer Now with your freelance journalist, Benedikt Steininger.